Okay, doctors, we'll be beginning in next 4 to 5 minutes. Okay. Right. Doctors, just to introduce myself, meanwhile, I'll introduce myself again in next 4 to 5 minutes. Some more doctors may join by then. So I'm Asia. I'm one of the doctors working in the NHS. I work in emergency department at the moment. So yeah, and I also teaching, especially teaching for Plab to OSCEs is my passion. I really enjoy it, and what makes me do it even more, that I actually see lots of positive things happening after my teaching. So that keeps me motivated. Lots of doctors who are struggling to pass, they come to me and they pass. Some have actually started their journey with me. And then when they come back and tell me that, they actually got good results, it all keeps me motivated. So yeah, this is not my main job, but I do it out of passion. I have not been, I'm sure many of you must have come across some of the YouTube videos as well on my YouTube channel. Sorry, I have not been able to do a free session for a long time because of my family commitments and my work. But here I am back again. All right, doctors, next 2 to 3 minutes. Anyone has any questions, they can raise their hand and I will unmute them. Or you can ask me question in even in the chat box, and I will try and answer it in next 2 to 3 minutes while we are waiting for other doctors to join. Okay, usually why I like to wait for doctors, because what happens is that when you have announced time for a particular time, then some doctors are like 4 or 5 minutes late, and then they want you to repeat, and then it takes lots of energy repeating everything again. So that's why I'm just saving some of my energy.
Hello, doctor.
Hello,
I'm
doc.
Dr. Humaira. I had a question regarding semen stations. So actually, I got to know that we need to do ABCDE in all semen cases. But some people are teaching that we need to do ABPU at first before doing the ABCDE. At first ABPU, even if in unconscious patients. So not in D part, but at first ABPU, then ABCDE. So what do you think?
Yeah, so if the patient is unwell and you approach that patient and patient is groaning and patient is like making some sounds and saying making these kind of sounds, so patient is not unconscious, and patient has some pulse, some patient is breathing, so then you don't need to do AVPU first. But then if the patient is unconscious, even then you start with ABCDE, because if someone's airway is not, all you check in Glasgow Coma Scale is you check for their response. You say, hello, Mr. John, this is Asya, one of the doctors. Hello, Mr. John, can you hear me? And you don't do any more than that. If they don't respond, then start on to your ABCDE. Doctor, it is very logical. If you think about it, this patient, you don't want his heart death and brain death to even prolong, where you will not even be able to help him at all. You want to make sure, if at all his airway is blocked, you want to clear it first, rather than checking is he brain dead yet or not. So
yes,
even
right.
prior to doing that, you want to check if there is some foreign body in his airway. You want to get that out, because that actually might kill him eventually, isn't it?
Yes. Thank you very much, doctor.
No
Another
problem.
question I had, in stable cases of semen, like do we need to, at first we start to take history and then check directly what is abnormal in the monitor, or in stable cases also we need to start from A, B, C, D, E. Can you
Okay.
tell me the approach, please? Yeah.
Yeah, sure. Doctors, no matter what, even if you are in a medical interview tomorrow, when you've passed Plab 2, you have gotten GMC registration, you're sitting in an interview. Even then, just don't think that just because a patient is not in front of me, I'm just going to approach the patient. I'm just going to start taking history first, and then I will check on A, B, C, D, E. They will fail you if you do that. Okay. So what they love here is that, in an unwell patient, you do A, B, C, D, E first. And during the A, B, C, D, E, automatically you will find abnormalities which you will correct. Okay. Or you will raise questions. Now, when a patient is very, very unwell, don't start taking detailed history. You just need very basic information. For example, if you're thinking that this patient might have had some poisoning, you want to check his drug chart. You want to check the nurses that, is there any history suggestive of that, rather than, what happened, did he take any overdose, how much did he take, when did he take, what happened, was the intention to kill himself. You don't want to ask all those questions, because there is someone literally dying in front of you. You need to save a life. So to save a life, the basics start from airway. A clear airway means you can save a life. So always, if there are normal stations, then obviously the approach is the other way around. The shorter answer to your question is that yes, always A, B, C, D, E. Start that approach. But in between, you can stop. Just don't be like a robot who will just keep on moving. I've checked breathing, I've checked circulation. If you find an abnormality, please correct it and then move forward. Okay.
Okay, thank you. Yes.
Imagine yourself that there is someone who is with acute exacerbation of asthma in front of you, and you don't want them to die. You want to give them some
Yeah,
salbutamol,
yeah,
some
I
protropium.
got it. Yeah, no,
So
I was actually asking about stable patients in cement, like acute limb ischemia, or like
they are
PPH.
not stable. They are not
I mean,
stable, doctor.
yeah, yeah, yeah.
They are not stable.
I mean
Acute.
conscious. Sorry, yeah, conscious
So
but
even,
unstable.
well,
Yeah,
conscious also. Even if conscious, A, B, C, D, E.
yeah. Okay, okay, yeah, got it. Thank you very much.
You're very welcome, doctor. All right, doctors, here we are. So we start our station, which I have promised you to cover today. All right, okay. So, doctors, we are covering one of the ethical stations today. Now, ethical stations are very, very easy. They sound very easy to cover and to pass. Now, why they sound, when you read them actually from the scripts or wherever, when you read them, you're like, oh, well, this is not even a problem. This is going to be like, a job of my left hand, and it's going to be a piece of cake for me. And then you go into exam, you perform the station as it was told to you, and you come back home, and on one fine day when you get your results, you find out you did not pass that particular ethical station. And then you're banging your head against the wall. What do I do? What did I do wrong? What happened? Why didn't I pass this station? Most of the time, doctors, most common reason that I have seen that why ethical stations are not passed. I have done hundreds and hundreds of mocks I've taken over past 1 to 2 years, and I have noticed one thing common in everybody who is not doing right, or why they are not passing ethical station, is because not taking sufficient history. Now, ethical stations are those stations where you can actually score 4 out of 4 in your data gathering. When you start taking a detailed history in diagnosis stations, you're never going to reach on management. And that's when, so you need to take focused history in your diagnosis stations. And the same is for your counseling stations. Counseling takes literally 3.5 to 4 minutes. So if you spend all your time just taking history in counseling stations, you will not get any time for your management. So those are actually your challenging stations where you have to squeeze down your history. But we actually, doctors most of the time for Plab 2, they do it other way around. So in counseling and diagnosis stations, they will take a very detailed history. They'll ask all the differentials possible in the world, and thus just spend all their 8 minutes taking history most of the time. And what they will do in ethical stations, they will not ask enough history. The reason being that they don't know which questions to ask most of the time. And usually you must have seen in your scripts or in your academy's notes as well that most of the time ethical stations are the one which have very small question answer session, and then comes your management, which they literally have copy pasted from some NHS website. This is what is happening these days, right? Instead of properly catering it to you because you've paid them money, they're just literally copying the information from a website and bringing it to you. All right. So doctors, my point is that please take enough history in ethical stations. Always keep in your mind that you're being scored in those 3 criterias. Always. One is data gathering. So you're scoring 4 in that. You're scoring 4 in management. So please do justice to all of these domains, and 4 in IPS. Okay. So please do justice to all of these. Spend enough time for each and every section so that you get like equally divided marks. All right. So what happens is, as I said to you, that doctors have no idea. Okay. So most of the time, why they have no idea that what questions do I ask? Because, okay, patient, for example, is telling you, doctor, I want contraception. I am 13-year-old and I'm coming here. I want emergency contraception. Or maybe a patient coming to you and saying that, doctor, I want to change my counselor, for example. Or maybe a patient saying that, demanding something which is not actually possible according to the law or medical ethics of the medical council that you are working under. Okay. So the answer to the patient's question is one simple word: sorry, this is illegal. And chapter closed. Okay. But will that give you will that give you a 12 out of 12? Will that give you enough marks to pass in that particular station? No, it will not. So you have to make sure that you take enough history. You manage all the aspects of patients, all the aspects of their life you manage in your management plan. It's not just matter of just answering, sorry, this is illegal. We all know by now that euthanasia is illegal in the UK. Simple answer. And why the hell Dr. Asia is conducting this session today? Crazy woman? Simple. No, I'm not crazy. I promise. I have seen doctors over and over again in mock sessions doing it wrong, performing it wrong. That's why I decided that I will do this for my beloved community of doctors. Okay? All right, doctors. So one thing is clear, as I have discussed with you, that euthanasia is illegal in the UK. All right. So doctors, first of all, you should be clear with yourself. You should know what really euthanasia is. Okay. I know there are many complicated definitions. Even the academy scripts of yours have just copy pasted it from the website and has given to you. The simplest definition of it is that a doctor is helping the patient to end their suffering, to end their life. Okay, a doctor is assisting, a doctor is helping. So that is what is called euthanasia. All right. But what if the same thing is done by a patient's relative? What will that be called? That will be called assisted suicide. Okay. So I hope these two terminologies are clear to you: assisted suicide and euthanasia. And also, please be clear that both of these, because patient at some stage may ask you for both of them. Just be very clear in your head that both are illegal. Don't do when they say like, doctor, can I kill my mother at least? Can I try and help her? Can I get her some medication? Can I overdose her? Can I help her to end her suffering? So that's what is he asking for? He's asking for assisted suicide. So you should say no, even that is illegal. All right. So doctor will go in, you know both the definitions now. Let's go systematically as I like it. Okay. I know there are hundreds and hundreds of academies who will teach you, and by the end of it, you will be clueless. There are online courses who will teach you, but will not go in depth of each and every station that they have promised you. They will just brush up quickly in 2 minutes. That's not my job. Even though I cover 150 or 200 stations in my course, but I make sure that I do those 150 or 200 in a way that you can do any station in your exam. Okay. And this thing has been proved over and over again by my doctors passing even the new stations appearing in exam. All right, doctors, let's dig into euthanasia so that other stations like this, like DNA CPR, can also become a piece of cake for us. All right. All right. Someone has scribbled over the page. Let me see, how can I fix this? Okay, doctors, sorry for the inconvenience. I'm just going to share it again. Okay, doctors. So, for example, doctors, in a scenario, okay, in your exam, there's a patient who's calling you and saying, okay, first of all, doctors, many of you, you have learned over the time that how to go about a phone consultation, okay? But the thing is that you're not introducing yourself properly, okay? It's very simple, and trust me, if you learn it today, you will be so you will not be babbling in your real job when you start in the NHS, because you have to make referrals every single day. What if it is your first day at work and the patient is having dementia and you have to take history over the phone? How will you introduce yourself? You'll be babbling. Okay. So get it sorted now. Just now get it sorted. So when you call, please, because I hear doctors doing it wrong. That's why I'm telling you guys, let's fix this. So this is how you're going to say it. Confidently. Confidence is the key. As I say, your Plab 2 journey will be easy if you keep your spirits up, your confidence up. All right. So you're going to talk like this. Hello. This is Asia, one of the doctors calling from emergency department, this and that hospital, XYZ hospital. Okay. I'm calling regarding Miss Alina Petrovich. Can I please talk to her daughter, Sarah? Yes, doctor. Sarah speaking. Sarah, can you please confirm your full name for me? My full name is this. All right, Sarah. Sarah, just to make sure that I'm talking to the right patient's relative, can you please confirm Mr. David's full name for me, okay, and his date of birth, and then ask the address. All right. So okay, fine. All of you know date of birth, address, all of that. Sometimes doctors, what they do, they ask date of birth of the relative. What are you going to do with the date of birth of the relative? That's not important to you. You just need their full name. All right. It's patient's details that you need to confirm, doctors. All right. And talk confidently. Okay. Talk like this. Hello, I'm Asia, one of the doctors calling from hospital, blah, blah department, blah, blah hospital. I'm calling regarding, this is the part which most of you, 98%, 95% of you don't do. I am calling. Okay, if some random person was calling you, wouldn't you want to know why are they calling you? I'm calling regarding your concern. I'm calling regarding the email that you sent us. I'm calling regarding the call that you made to us this morning. Why are you calling? Okay, that will make all the difference between you and all the other academy doctors. Okay, doctors? So start the chat like that. Now, this gentleman is probably speaking from another country where euthanasia is actually legal. Okay? So, Mr. David's son, William. So, we are going to talk about today Mr. David and William, his son. So, his son, William, is calling. Okay? Mr. David is, assume that Mr. David is 76-year-old and he is in the care home after having a stroke. Now, it was a massive stroke and the recovery from the stroke is just not possible. Okay? And he is on palliative care. All right? He's on palliative care. Now, the son, William, calls you and says, Doctor, I want to talk about my mother or about my father. Okay. So you will say, yes, definitely. I understand that you've called regarding your mother's condition or your father's condition. We'll definitely come to that. But can you please tell me how much do you know about them? Okay. Because you don't want to be just throwing the arrows in air. Okay. You want to make your point until where the patient's relatives know. Then you want to start from there onwards. Okay. So the first thing is to check their knowledge. How much do they know about their relative? Okay. So they will tell all the story. They will say that, doctor, yes, my mother was admitted in hospital. My father was admitted in hospital. Doctors told us that they have had a massive stroke and the recovery is just not possible now. The hospital has discharged them back to the care home and they are supposed to be on palliative care now. Okay. So then you ask them, okay, David, you have, seems like you're a very caring son. William, seems like you're a very caring son and you have, it's good to hear that you keeping a good update about your mother's condition. Okay. But David, could you please tell me if you have any specific concerns or you have any specific expectations from today's consultations? Doctors, you know what? Again, I will give the reference of the mocks that I see doctors just missing the main point, the gist of the station, the focus of the station, the main task of the station, they miss most of the time. Just by not asking the concern or the expectation early on. Okay. Doctors, just give me a second. I'm coming back to you in a minute. Okay, doctor, sorry about that. Okay, so ask the expectations and concerns early on. All right, as I've said to you, ask them early so that you don't miss the main task, the main focus of the station. All right. Okay, now this is another thing which is quite generalized. Okay, we can easily generalize it. So during my course in Plab to exam, why when I conduct the course, how I say that you are able to cover other stations as well very easily, because I generalize things throughout, which you can use in other stations as well. Okay. So, for example, this is something whenever you ask patients' concerns, this is how you have to react, because your IPS is not about, I'm sorry, I'm sorry, I'm sorry. Your IPS, if you have good IPS, your IPS should be acknowledging their verbal and non-verbal cues and responding to them. And when a patient is telling you their concern, something that they are really worried about, okay, that you should acknowledge it. Most of the doctors, they ignore it and move on. They are just in so much of hurry to ask rest of the history. So you say to them, they say, doctor, well, I want to know if at all I can end my mother's suffering somehow. And you ask them, Mr. I understand, Mr. William, that you're quite worried about your mother, but could you please give me a clear idea what you want to talk about? Doctor, I want to talk about euthanasia. I want to know if I can end my mother's suffering by assisting her to die. Okay. So then you say to her that I can see that you're quite worried about your mother. And this is the sentence that you should quote everywhere when you ask the concern. This is how you should respond. Mr. William or William, your concern is very valid. Let me reassure you that I will get back to your concern, or you can say, I will be addressing your concern at some point during this consultation. Okay. So you promise them that your concern is valid. First of all, you say to them that your concern is valid. I can see that you're quite a caring son, but let me ask few more questions and I will be in a better position to address your concern. So one of the either way that I've told you. All right. All right, doctors. Then this is, you told them there it is valid concern, you reassured them that you promise that you will be addressing their concern at some point. Okay. So this is all that how you acknowledge their concerns and you respond to them. Doctors, it may sound very prolonged, but when I help you, when I come on a free session like this, I want to help you in a way that you benefit the most and you can cover other stations as well like this. All right. Okay. Right. Okay, doctors. Right. So, doctors, the patient has the relative has told you that the whole story, that how much they know about their mother, what happened in the hospital, and what has been decided by the multidisciplinary team. And now the mother is on palliative care. Okay. You want to know if at all the doctors have shared any other information. Why you're asking this question, doctors? Why you're asking this question? You're asking this question that any other information given by doctors, because you want to know if at all this gentleman knows already that what does palliative care consist of. Okay. So that's why you ask him, have they shared any future plans? Have they shared how will you your mother will be looked after? So you can put this question any way. Okay. In your own words. All right. Then doctors, any elderly patients, any patients who are are coming with comorbidities, It's an important question to ask in all those stations, whether it is confusion, delirium, constipation, urosepsis, wrist fracture, pelvic fracture. All these elderly patients, ask them this question. Okay, how mobile are they? How do they mobilize? It's a key question, doctors. Always ask this. In hospitals, in the NHS, it is so important, doctors. It is so important. Now you will ask me many questions. Actually, in Plab 2, we ask academies make us ask those questions, but they never tell us really that why do we ask this particular question. Okay, I'll just leave it for now at the end of the station. If anyone is curious that why do we ask mobility question in elderly, many of the answers I got after I started working in the NHS. Then I got the answers. Why did we ask that particular question? It's so much more easier and makes sense rather than just like a robot by hearting everything. It makes sense when you know why you're asking something. Okay, so ask, how was your mother's mobility? Okay, is she still mobilizing? Okay, all right. Is your mother in any kind of pain now? Because you said suffering. So, what kind of suffering? Have they told you anything about her symptoms? What do you know about her symptoms? Is she in any kind of pain? All right. All right, doctors. Now, this is what I call a safeguarding question for all the pediatric stations and all the ethical stations wherever a relative is looking after or is responsible for the care of an elderly patient. Okay, so again, doctors, I will give you the reasoning why you ask a particular question so that you'll never forget in your exam as well. And you will say, I will echo as my doctors give me feedback. The doctors who attend my course and pass, they come back to me and I get this common feedback. Makes me very happy that everyone has something in common. They say, Doctor, when I went to the exam, you were echoing in my ears and you were telling me to say, your voice was telling me to say one particular thing. And guess what? I got 12 out of 12 and makes me just, I float in the air when I get those kind of news. All right. Okay, doctors. Just a happy thought to share with you. Sorry about that if I'm wasting your time. Okay. Anyways, all right, doctors. So this question is part of safeguarding. This is what I learned when I went into the NHS, that why am I asking this question from mothers every time they come to pediatric emergency? That, okay, your child is unwell, but how are you coping? Why am I asking this question from someone who's taking care of dementia patients? Why am I asking this? How are you coping? So I got my answer. I assumed during my preparation when I was in your place, I assumed this is for a good IPS. Okay. Definitely it gives you good marks when you ask this in IPS. Definitely you score well. But the actual purpose, the technical purpose of asking this question is safeguarding. Okay, safeguarding the adults in this case. You know why, doctors? Because this gentleman might be asking you to kill his father or his mother because he is suffering mentally. To begin with, he could have been affected by their own father's or mother's condition. I'm sure many of us have gone through that. Any loved ones are not feeling well. We can't concentrate on our work. We can't concentrate on our, especially doctors, I think they will relate more, who are living away, living abroad, away from their parents. You can't concentrate on your own children, your family, your wife, when you know that one of your parent is not feeling well. And that's the case with this gentleman. Okay? Because he can't come and see his mother. He lives in Sweden and he can't come and see his mother. He can't take care of her. So he is feeling hopeless. and saying, kill my mother, so that I get peace of mind. All right. I'm not saying that's 100% is the case, but that can be the case. And you're a doctor, you want to prove to GMC examiners that I'm a safe doctor. I'm safe at all times. That's why you're asking, how are you coping, William? William, by the conversation that we had so far, I have just gotten an idea that you're quite a caring son. But I'm a bit worried about yourself as well. How have you been coping with diagnosis of your father? Are you getting enough sleep? Are you coping all right at work? Or do you think, or are, you can ask like this, are you able to concentrate on your work? Okay, so you were indirectly actually worried about Mr. David, okay, the patient, that this guy could have been feeling hopeless, and he's asking us, or maybe he's convincing his mother or his father that you shouldn't be here anymore, okay, and go against the law of the country. So that might not be the case, but being a safe doctor, we have to rule out this anyway, isn't it? Okay, doctors, I hope I have made sense, and just make trying my best so that I make sense. All right, doctors. So these questions you will ask in history, some more questions in history that you will ask. As I said, that ethical stations are the ones where the most common cause of failing the station is not taking sufficient history. Okay, do ask him that, William, if you live in Sweden, do you have any family members who live in the UK? Okay, do you have any family support back in Sweden with you? Okay, anyone to support him back in Sweden? Okay, any financial challenges at all? Okay, with yourself or Mr. David or the patient? Okay, are, are you or Mr. David going through any financial challenges at all? We are covering the psychosocial part of patient's life. Okay, so we are psycho is, we already asked about mood, sleep, work of his son who's saying that kill my father. Okay, and now we are social aspect also we are covering. Okay, any concerns about care of Mr. David? When I say this, I'm asking that, are you not happy with the care home? Are you not happy with the quality of the care? Are you not? So in Plab 2 exam, it is also very important that you ask focus to the point questions in a very short way, because you have less time. So just generally just ask, do you have about any concerns about Mr. David's care? Okay, also you can ask any DNAR decisions or any treatment refusal decisions already made. Okay, has Mr. David made any do not attempt to resuscitate decision, any lasting power of attorney? Has he appointed anyone as a lasting power of attorney? Okay, doctors, if anyone is unclear from you, who doesn't know do not attempt to resuscitate, who doesn't know treatment refusal, who doesn't know what is lasting power of attorney, please let me know. I will explain to you at the end. Okay, but I'm assuming most of you know what this is. All right, so these are the key questions. Make sure you have asked all of this. Okay, right? Okay, doctor, so this is our data gathering. All right, we have covered all the psychosocial aspect in our data gathering. All right, now doctors, come your management plan. All right, in at all times, in all the stations, no matter what is the type of station, whether it is counseling, whether it is diagnosis station, whether it is ethical station, Please do not, some doctors, for example, the other day I was doing the where a lady comes and says that, doctor, I do not want steroids, I do not want to continue my steroid medication anymore, and she's having PMR. So the doctor in the mock, what he started doing, he started asking me, well, because why we can't stop steroids, because stopping steroids all of a sudden is not recommended. Steroids are to be taken for 2 years in polymyalgia rheumatica. So look, that doctor is doing actually the right thing. He's giving me the correct information. But when he will get his report card on result day, on big day, he'll find out that he has not passed that station. And he'll wonder, why didn't I pass? The reason being, you did not stick to your structure. So one of the things GMC states on its website, that they will not like you, they will not be happy with you if you mess up with the consultation structure. So you did not listen to the patient enough, or you did not do sufficient data gathering, and you started addressing their concern. Doctors, it also makes sense, it's logical. Please know the problem properly first, then only try and solve the problem. Don't start solving the problem at the beginning, and then you are sitting like a like a dumb person. You're just sitting there and you're like, why the station is not ending? Okay, so take take sufficient history. All right, okay. So now the management part. So you will ask, as I said, stick to your structure. Why I said stick to your structure? So you will take your data gathering, you will take history, then you will come to provisional diagnosis. And now you're going to say, crazy woman, why is she talking about provisional diagnosis? We don't have any provisional diagnosis in ethical stations. But just for the sake of structure, keep that structure in your head, that if a patient comes to you in the exam and says, doctor, will I develop dementia, will I develop stroke? So ask them, what do you know about stroke? Doctor, my mother is deteriorating so much with dementia. What do you know? So you take data gathering, you take history, and at some point, at this point, this is the point where you come and you say, what do you know about dementia? So that you can start from there onwards, how much they know. Okay. What do you know about euthanasia? Okay. So they may, in the exam, in Plab 2 exam especially, they will pretend dumb. They will say, I don't know much. I only know that a doctor can help. Okay. Then you will remember the definition. Okay. You'll remember a proper definition, that actually euthanasia is where a physician or a doctor can assist in ending the suffering by giving an overdose of a medication. Okay. So just to let you know that this is not legal in the UK. Okay. And it is against good medical practice in the UK. And if anyone tried to do this, what will happen? They will be entitled to punishment. Okay. Any doctors committing this act will face consequences of lifetime imprisonment. Okay. I will not only lose my GMC license, but also I can be imprisoned for lifetime. Okay. So I'm really sorry, but please stay reassured. So other doctors from the academies will not do this. They will just say, well, I'm sorry, I cannot do this. You go to hell. Okay. No, I mean, that go to hell part is added from me. But that's what you mean when you just say to them, sorry, this is not legal. But that's not how you want to perform in your ethical stations. You will say, at the same time, your reassurance will come. You will say, Mr. William or William, Let me reassure you, there are many other ways. Sorry to disappoint you on this matter, but there are many other ways that we can help you. Okay? Would you like to hear about those? All right. So, doctors, the patient can also ask you that, doctor, why is it when you say that legal, it's not legal in the UK? They can start arguing and they can ask you, but doctor, I live in Sweden. It is absolutely legal here. Why not in the UK? Okay, so then you can tell the patients that this is not what it is. Okay, the law is actually not created by anyone but the government of the country. Okay, so the legislation is created by the country and we are all to be abide by this. Okay, we all have to respect this. All right. So different countries have different legislations, different rules, and hence the reason why Sweden has different rules and regulations. Okay, and we respect that. Okay, say we respect that, but that's not the rule in our country. All right. So then he might say that, doctor, okay, fine, if you don't want to kill, if you cannot kill my father or end his life, can I do this for him? Okay, can I give him some overdose? So tell him that I can see, I am responding to what he's saying. I'm not saying no, you cannot kill. So the answer is no, you cannot kill, that is also illegal. But listen to me, how am I saying it? I'm acknowledging the desperation in his voice. Okay, and I'm saying, William, I can hear from your voice that how helpless you're feeling for your mother. Okay, and I know in this situation anyone in your place would have felt the same way. They would have felt any way to help their parent. Okay, sorry, I'm really sorry to see you in this situation. Okay, but I'm sure there are many other ways you can help your father. Okay, or Mr. David, don't say your father, your son, your daughter in your exam. Try and name the patient. Okay. All right, doctors. So if they say that, can I kill? You tell them that no, I know that you feel desperate, you feel hopeless for this, helpless in this matter. But unfortunately, it is also considered illegal if a relative is trying to kill. That is referred as assisted suicide. Doctors, do you remember the definition at the beginning of the session I told you, right? So that's considered that as assisted suicide, and that is illegal as well, and anyone committing this can be entitled to 14 years of imprisonment. So lifelong imprisonment if a doctor does it, and 14 years of imprisonment if a relative does it. So when doctors does it, what is it called? Euthanasia. If relative does it, what is it called? Assisted suicide. Okay. So tell him that there are many other ways that we can help you with. Okay, would you like to hear them? So did you notice that I'm keeping him involved, I'm keeping him engaged? That's another key part. Scoring well in management plans. Many of the doctors, they come and they say, oh doctor, I failed, I attended this academy, I failed, I just copied everything in their management plan, and then I told the whole management plan to the patient and I did not pass. The reason why, that you just became like a robot and you just uttered the whole management plan without involving your patient. You did not check on them. Okay, so involve your patient. So that's why I'm asking him now, David, would you like to know other options? How can we help you? Okay, and then he will say, yes doctor, I would like to hear. So you will say that, first of all, I want to tell you that the purpose of palliative care is to give patient a high quality, painless, symptom free, period, okay, prior to or maybe during last days of their life. Okay, the purpose of palliative care is making their last days, okay, or making end of life as comfortable as possible. Doctors, be yourself, use your own sentences. I'm just saying it in many different ways so that you can use one of those. Okay, so you will say to him, in palliative care, do you know what all it includes? No, doctor. First of all, we try and make patient symptom free. So we have many ways, if at all, Mr. David or Miss Sarah, whatever the patient's name, if at all they are in pain, we'll try to relieve their pain. At this stage, we are least concerned about the side effects. Okay, so sometimes higher doses of strong painkillers like morphine is used. Okay, and sometimes it is used through a some pain relief is used through a syringe driver under their skin, where they can inject themselves a controlled dose of a certain medication. Okay, what am I talking about, doctors? Patient controlled analgesia. Okay, we also make sure whether they are in care home, they're in hospice care, or at home, wherever they are receiving palliative care, we make sure that we assist them to change their position so they do not develop ulcers. Their hygiene, their mouth hygiene is taken care of. Okay, and if they are finding it hard, or even if the family is finding it hard to cope with the diagnosis of terminal illness, we offer counseling sessions and talking therapies. Doctors, sorry about the wrong spelling here. This is charities. Okay, so you can also tell, you can remember one or two organization names. You can say that in the UK there are many charities who are supporting patients, and then they help the patients to cope with their terminal illness or terminal illness diagnosis, because we have noticed that it can be quite difficult to digest the news itself that their illness is terminal. Okay, now David, you being away in other country, we might not be able to help you with our medical aid, but if you think you are struggling with your mood, you are not able to concentrate on your work, probably it is high time you can visit your mom. But because of COVID, if you are not able to travel, then let us know. We can send an email across to your health system or your doctor, who can probably suggest something, okay, or some counseling sessions to you. All right, so try and help him, this poor guy. All right, so then you can say that, if at all Mr. David is patient is suffering with any or has any financial challenges, there is always a social carer attached to them in the hospital, and in the community as well. Okay, so wherever they are, a social care worker can visit them and can ask them their problem and can try and help them with their financial benefits that they might be entitled to. All right, um, there are other options, like there is do not attempt to resuscitate form that can be filled by the patient. Okay, and there is also a treatment refusal form that can be filled by the patient. So do you want me to explain that? So yes, doctor. So your mother, if she has mental capacity now, okay, she can decide, she can make a decision that she does not want to be resuscitated if at all she deteriorates. Okay, she can also decide if she does not want any aggressive treatments like steroids, life saving drugs, or antibiotics. Okay, they can decide that as well. All right, and they can also appoint a lasting power of attorney. So they can appoint someone from your family or from your relative, or they can even appoint you. Your mother can even appoint you, that you can decide for her. For example, when she's unconscious or she does not have mental capacity, For example, if you decide that you will not want a nasogastric tube down to her throat, or you will not want any airway, artificial airway, or any artificial ventilation, if at all she deteriorates, you can decide, you can take these decisions for her. Okay, so these are the options. That I'm really sorry again. I really apologize if I was not able to um, fulfill your expectations, but this is the best possible way. But please stay reassured. We are trying to make this period as pain free as possible for Mr. David. Okay. All right, doctors. Any question? Okay, doctors. Any questions, doctors? We have some special guests. Please don't leave as yet. Some doctors who have passed in the past, they will give us some ideas. They'll give us some tips. So stay connected still. But do you have any questions prior to that? How about I answer your questions? Because my colleagues, my dear doctors, um, I will tell you how can you do it in 8 minutes. I will tell you, doctors. So let me see if I can get them on board. Okay, doctors, just 2 minutes. So doctor said that how can we do this in 2 minutes? Doctors, as I said to you at the beginning of the session as well, I do the station in a way that I'm not just helping you for this one station. I explain everything, I dig into everything so that other stations like this also become a piece of cake for you. All right. So if you can do this station, you will be able to do other stations like this. Like, do not attempt to resuscitate. Your data gathering, most of it remains the same. Okay, apart from assessing patient's mental capacity, the rest of the history remains mostly the same. All right, so you will be, trust me, I can practice in front of you, I can do it in 8 minutes, and if I can do it, you definitely can. Okay, it's very short history, very short management. Okay, Dr. Anaya, I will let you ask question. I've got a doctor with us who can probably give you some hints and how did he pass. um, yes, doctor, I will upload it to YouTube as well. Probably, but don't know. I cannot tell you because I have work. I cannot tell you when will I upload it, but whenever possible. Right. Okay. Dr. Husnain, are you with us?
Yes, Dr. I'm here.
Okay, right. So we've got Dr. Husnain here. Dr. Husnain works in the NHS now. So Dr. Husnain, just give us an idea. How did you prepare, and any tips that you can give doctors who are in this journey now? That some quick ones, really. We don't want to take a lot of time of yours because I reckon you're back from work.
Yeah, so first of all, about this course, when I started my Plab preparation last year, I started with this course, I think by end of the year. After that, I didn't take any academy because it was a really comprehensive course. And the best thing about this course is that you get a simplified pattern. She combines different stations into one category. So you don't have to do remember all the stations, do remember history for all of the stations. So it's just a remember a pattern for a category, and in that category there may be 20 or 30 stations. So you are sorted off for these stations. So that was really good. I can't go through every detail, but it was really good, and I'm sure that whoever takes this course will not regret this. Well, PLAB-T is less of a medical exam. It's more of a exam about communication skills and how things work in UK. So although we are from different countries, we haven't worked here, but they do judge on those things. So it's really good if somebody's working here and they're telling you how things work here, because they expect you to know these things, although you don't have work here already. So that's the thing, and it's about keeping things really simple and managing things in time, well in time, managing patients' concerns is really important. So those couple of things, and I'm sure you have explained all those things already, but from my side, that's the
No,
key to
that
this exam.
definitely is very helpful, doctor. That
Yeah.
definitely is helpful. Doctor, many a times doctors have this question. I get this question a lot. Doctors who attend my course and then they say, Doctor, are there any academies who actually offer any Simmons and mannequins? Also, they ask this question very commonly that is it possible to pass this exam without attending a proper academy by giving them 600-700 pounds? Is it possible, Dr. Husnan? And not just you, are there any of the friends who have done this?
So the thing was that the reason was that I didn't attend the academy was I already had your course, so I knew how Plab-T worked. Plus, I wanted to attend the academy personally, but it was COVID, so I couldn't attend it. So I decided not to go for it, as I already know how Plab-T works. So I was confident enough to go about it. The thing about the examination stations and Simmons station is that if you go to the videos on YouTube, there are different channels, there are different people who have done these things. So that gives you an idea. And if you have worked in
Can
a
you
clinic,
name two such channels, doctor, who can actually give, because it'll be very helpful for hundreds of doctors who are just here now, and they will know, it will be very helpful for them if you can name two channels which are give some idea about examination stations.
yeah, say about Simmons, I did the Simmons from iMedix videos.
Mm-hmm.
Those were really helpful. And they have done videos about each and every topic that usually come in the exam. So I did
Okay.
Simmons from those. And regarding examination stations, it could be any video. You know, if you search on YouTube, they will give you a video. Even it's by Ankur, a lot of videos been
Yeah,
done by him.
Ankur Garg is one. So one is
Yeah,
Ankur Garg, the other one is Geeky Maddox.
yeah. So those are for examination. And if you want to do Simmons, the iMedix videos, they are
Yeah, they're
free.
really good.
There's a drive. You will find it on Google or something.
Yeah,
Uh,
yeah.
that's for
And I
Simmons.
think that's a very reasonable course as well. I don't know how expensive it is now, but the time that I bought it, it was, I think, for 1 month it was only 19.99. I think £20. I don't know. Somebody told me it became expensive afterwards.
I didn't go for a subscription because uh, I think if you search in Google or something, if you ask
Oh, you
people,
can find it.
you can find the videos.
Oh,
So,
okay, right, okay. But I recommend doctors. I think one of the doctors has left me broken heart, because someone subscribed to my course, and another friend in the hostel was trying to record from his computer while he was doing his laundry, and it really broke my heart that how much effort are you putting, and you are not realizing the effort of a person who has put together this course, um, after how much of struggle and pain and hard work. So I think I would suggest even small amount of money. Trust me, doctors, you will be able to all earn all this money back in no time. I think Dr. Husnan will agree with me, isn't it, doctor?
yeah, so if somebody doesn't allow you to don't do it. The thing about those videos is they're old one. They're not
Uh-huh.
updated. So
Okay.
that's why they are readily available. The updated ones definitely need subscription. But you can get
Right.
an idea even with the old ones.
Okay, amazing. All right, Dr. Husnan, thank you so much for your valuable feedback, and I'm sure it has helped lots of doctors. Um, Thank you so much.
No worries.
All right.
Right. Thank you.
Thank you, doctor. All right, doctors. Doctors, you have any questions? Dr. Anaya's hand is up for a very long time. Dr. Anaya, what would you like to ask? Unmuted. I've unmuted everybody.
Actually, do you have any weekly sessions or I love I saw your gender dysphoria this video, I saw your ECG videos. I think currently no fresh rooms are coming. So kindly can you give us any group or link we can join you?
Well, doctor, there's recorded course that I run, and it's very small price that you pay for a course, and the pass rate so far in last 2 years or so, it has been 99%. And I'm not just saying it. I have not been able to do lots of free sessions because I work, I have 3 kids, but I try and help free sessions whenever possible. I have a YouTube channel. I will, if you are on my Telegram group, I will share the YouTube channel link again. But yeah, course details, doctors. It is you can get in touch with me. I will share my phone number here, which is my WhatsApp number as well. I will give you further details. It's a 17-day course. There are 4 hours. Each lecture is 4 hours long. Okay. And you get to watch those videos. They are with you for good 48 to 72 hours. If you still struggle, I give you even extended period to watch just one lecture. You can take breaks between the course as well. So it's not like other online courses that once you start the course, you just have to get stuck with it for whatever days. If your exam is, for example, 6 months after, 4 months after, you are still stuck with this course. No. So you get to take breaks between the lectures. You can digest it properly. You stay in touch with me continuously. And you can ask me questions. No other course gets this kind of personalized approach where the teacher actually stays in connect with you, until you pass your exam and answer your queries. All right. People who do it commercially, who do it for money, they will just find different ways of making quick money. Doctors, there is a group mock happening on Thursday. It is £10 per person. Okay. And you can join in that. I also regularly every week I do mocks. I conduct mocks. There are 10 stations in each mock, £60 for each mock, and they include face-to-face consultation where I do it on Zoom. I turn on my camera, I do it face-to-face, and then we do some 3 to 4 phone consultations as well. And there are 10 stations. It costs £60. You can also observe mocks. So you can get in touch with me if you want to observe. So there is a very small price that I asked you to pay for observing the mock. Now, observing the mock is also a very good idea. You can learn from other people's mistake, and then again you get to ask me questions at the end of the mock as well. That Dr. Asia, why this particular thing? Why did you ask this doctor to not do it this particular way? What was the reason behind it? Why can't we do it the other way around? So you can get to ask even if you're observing a particular mock. All right. Even for the mocks, doctors who have ever attended the mock, no one has ever came back to me and said, I attended your mock and sorry, I have not passed. Very good feedback. And I just feel blessed. I just don't give 100% credit to myself, of course. It's very hard working doctors that so far I have come across. All right, doctors. Any other questions at all before I leave?
Yes, doctor. Yeah.
Yes,
Hello.
doctor.
Can you hear me?
Doctor, yes, doctor, I can hear you. Let me just also share the Telegram group link so doctors can join my Telegram group. but you can continue to ask. Doctors, I'm just in the chat group.
Okay. Okay. I wanted to know about, you spoke about the DNAR and the treatment's refusal form. All right. The options you're giving the patient relative during the management. Now, I wanted to know whether when you explain this DNAR and treatment refusal form, in the event of explaining the DNAR, do you offer options you give the patient? Do you also tell the relatives about other options aside if the patient decides to sign the DNAR form? Done?
Yeah. So you ask them in the history that is there any TEP form, treatment escalation plan form, signed by the patient already? If they say no, it hasn't been signed, then you can let them know in management part that actually there is a treatment escalation plan. There's a do not attempt to resuscitate form that can be signed. That might be one of the options you want to consider if it has not been done already.
All right. That's fine. Okay.
No problem. You're very welcome, doctor. All right, doctors, any other questions? So course, doctors, recorded course is only, if you sign up to it today, tonight, or tomorrow, it's £100 for you. Usually it's £125. But doctors who have attended this session, there's a special offer for you guys. And group of 3 can pay £90. This offer is just for this session, not other times, doctors. So the amount of information and amount of things that will be covered in this Plab 2 course, that I can reassure you, no one else will dig down onto things and will give you. Okay. Any other questions, doctors? Any other questions? If there are no questions, doctors, I'll take a leave. All right. And I hope to see you soon. Yes,
hello?
doctor. Yes.
I wanted to ask about lasting power of attorney. Like I know that this is given to next of kin, but I wanted to know, is it important to be on papers, or if there is next of kin, automatically they become lasting power of attorney?
No, they don't automatically. So lasting power of attorney, yes, doctor, it is £100 for recorded course. All right, doctors, let me just share the YouTube channel link as well. Doctor, I'm going to tell you the difference between lasting power of attorney and next of kin. So all the next of kin cannot be lasting power of attorney. So anyone, for example, is a relative of a patient who is very unwell and almost approaching the end of life. So if a patient has not appointed anyone on the paper that this is my lasting power of attorney, now that particular relative who has the authority of lasting power of attorney can decide for a patient, for example, this patient should not be resuscitated. He should not have an NG tube. He should not have an antibiotic. He should not have steroid treatment. He can decide because he's given that power. But if that power is not given to a relative, it will be decided by doctors, not by the relative.
Okay. Thank you very much. I was a bit confused about it. Thank you very much.
No problem.
It was very nice. Thank you.
You're very welcome,
Allah
doctors.
Hafiz.
Allah Hafiz, doctor. Bye-bye. Any other questions, doctors? No? You're all happy with that? Yeah. Seems like everyone is happy.
टेलीग्राम पे इसको उसमें टेलीग्राम में ओके ये डायरेक्ट शेयर करते ना YouTube पे.
Okay, Dr. Priyanka, I think you don't have a question. You can mute yourself. Doctors, no questions? May I take a leave?
No.
So, Dr.
what did she ask? Dr. Olushola, I think you're from our course. Do patient relatives sign DNFR form? I thought it's the doctors who do that. So it's not, you are not asking that patient's relative should do DNAR form. It's signed by the patient. If not by the patient, when patient has lots of comorbidities, this decision can be taken by doctors. So I'm not saying DNAR will be signed by the relative. Okay, DNR do not attempt to resuscitate can be decided by the relative if at all he has the power of attorney. Okay, I hope, doctor, I have answered your question. Yes? All good? Okay, doctors. All right, doctors, great. Look after yourself and best of luck with your exams. Stay in touch and see you again at some pre-session. If not, definitely at my recorded course if you decide to take it. Yes, so don't forget, there is on Thursday, there is a group mock as well. Very small price for that, £10 per person. You get to perform in one of the stations and you get to observe rest of them. So you learn from others' mistakes as well. All right, just for a small price of £10. Just imagine. Okay, right. You're very welcome, doctors. Okay. Great, doctors. Take care. Bye-bye.
When you find academia and 10, you start asking all these questions.